All right, welcome everybody. My name is Kyle Magatelli. I am the social media and webinar coordinator for the Student Doctor Network, and very excited to have everyone here right now for our Health Professional Students Association webinar with the AAMC, Your Path to Medical School. So all of our AAMC program representatives, thank you very much for being here. I'm a premed myself. I'm applying this next cycle, so I'm excited to learn about what you guys can tell us that we need to know for getting to where we want to go. So first and foremost, thank you so much for taking the time to be available and doing this with us today. So Student Doctor Network, we're a nonprofit we're focused on providing resources to students to get to health professional school. And I can talk until I'm blue in the face, but the best things you can do, go to studentdoctornetwork.net. Studentdoctor.net. I am absolutely not on my game today. I'm excited just to hear what everyone else has to say and get the heck off screen, to be honest. So go to studentdoctor.net, poke around. All of our social media links are on the bottom of the main landing page. And I actually have a video to tell you guys a little bit more, far better than I can do. So bear with me. I'm going to remove everyone from the screen one by one, show that video, and then I'm going to stop talking and turn it over so we can get to what everyone's here for. So one moment, please.
Years, the Student Doctor Network has supported students seeking to become healthcare providers with advising, tools, and resources. SDN is best known for our moderated forum community, with free advising services from vetted experts, insights from practicing and retired professionals, and peer support while applying to and attending health professional school. SDN also offers other free resources, articles, and tools to help you. Best of all, these resources are free thanks to the donors and members who support our parent 501c3 nonprofit organization, the Health Professional Student Association. Our mission is to help students from medically underserved areas become healthcare professionals, and we've helped thousands reach their career goals since our launch in 1999. We hope you find our resources helpful as well. Check out links to these and other tools in the channel description. Like and subscribe to be updated when we have new videos available.
The entire reason I pulled everyone was to try to get that video to not cut off the first word, and it didn't even work. Go figure. So that's enough out of me. Turn it over to Brandon Brown. Please take it away, sir.
Absolutely happy to, Kyle, and good afternoon, everyone, or I'll just say hello, depending on what time it is where you are. Give me a moment to share my screen. Okay, so greetings again. My name is Brandon Brown, and I'm the Senior Outreach Specialist for Services Communications at the Association of American Medical Colleges, the AAMC, or the AAMC. Fair warning, we may use either of those names to refer to our organization today, but just know that we all of those names, and whichever you decide to call us by, all represent the same wonderful organization that is here to share with you some of our resources and information to assist you on your pathway to medicine. As you can see, I'm joined by some of my wonderful colleagues. So now I want to give them an opportunity to briefly introduce themselves. And I will turn it over to Candace first.
Thanks, Brandon. So hi, everyone. My name is Candace Pantor, and I am the Manager of Admissions Communications at the AAMC. So I work across all of our services for Premed. So that's the AMCAS application, the Fee Assistance Program, the MCAT, and also our preview exam to make sure that you guys are getting all the information you need about those services. Looking forward to sharing information with you today.
Thank you so much, Candace. Now let me turn it over to Leslie.
I was wondering if you were going to go to me next, Brandon. Hi, everybody. I'm Leslie Ward. I'm the Director of MCAT Outreach and Engagement, and our team works to support premeds like you, getting you information on how to take and prepare for the MCAT exam. So really happy to be here today.
Thank you so much, Leslie. All right, next I'll turn it over to Laura.
Hi, everyone. My name is Laura Siegel. I am the Senior Web Content Specialist on the Aspiring Docs team. And together, me and my team, we basically share resources and inspiration for individuals who are at the very beginning stage of their journey. So folks who are just deciding on a career in medicine, or maybe they're still in the process of deciding and they just want as much information as possible about the profession. And I look forward to sharing some more resources with you in a few minutes.
Thanks so much, Laura. Next up, I'm going to turn it over to Tony.
Good afternoon, everyone. My name is Tony Mancuso, and I lead communication efforts for the Summer Health Professions Education Program. And you'll learn a little bit more about this program, but one thing I want to say is that, one, it's completely free, and two, we have a focus on increasing diversity within the health professions. So definitely stay tuned.
Thanks, Tony. And last but certainly not least, Julie, please introduce yourself to our audience today.
Hi, everyone. I'm so happy to be here with you. I specifically work with the FIRST program, and FIRST stands for Financial Information, Resources, Services, and Tools. I'm really excited to talk with you and answer questions today and share even more information next month, which we'll talk to you a little bit about as we go through this presentation. So thank you so much for joining, and I'm going to turn it back over to Brandon.
Thank you, Julie, and thank all of you for those great introductions. First, we want to thank the Health Professional Student Association for the conversations and collaborations that led to today's event. The AAMC considers organizations like HPSA a valuable partner in our current and future efforts to diversify the field of medicine and to ultimately make healthcare more equitable, inclusive, and beneficial for all. If you haven't heard of the AAMC or may be unsure of what we do, we are a nonprofit organization that focuses on transforming healthcare in 4 primary mission areas: medical education, medical research, healthcare, and community collaborations. Our mission is to lead and serve the academic medicine community to improve the health of all. The AAMC works through many different avenues to support and facilitate medical education. And one of the ways we do that is by providing services and tools for pre-medical students, medical students, and residents. So without further ado, let's launch into today's presentation. So now there are many different places you can get information to support you on your pathway to medical school. For the last few years, the AAMC has transitioned to supporting all aspiring physicians and advisors by switching to more digitally focused channels. Pardon me. The Premed Resources webpage is one of our most useful digital tools. Our Premed Resources collection includes various links throughout the AAMC's Students and Residents Hub for easy navigation, as well as print-friendly handouts of all items that we would normally distribute at in-person events. This page was designed to mirror the applying to medical school journey, making it more accessible to applicants and advisors looking for information to guide their advisees. And just a kind of a note, throughout the presentation, you'll see the simple links to the different areas of our website. So just feel free to jot those down, and we'll also make sure that you get those as we continue to go throughout the session. So now all of the resources that will be mentioned today do reside on our Students and Residents website. This website is a great starting point no matter where you are in your journey. You can always search for information using the menu to navigate to topics that you would like to learn more about. Alrighty, and without further ado, I'm going to turn it over to Laura to talk to us about aspiring docs and the Premed Navigator.
Thank you so much. I'm very excited to be here. As Brandon mentioned, I am part of the Aspiring Docs team, and we are all things resources and inspiration for aspiring physicians. And on the right-hand side of the screen, you will see our social media profiles, which is a great resource for our latest content. If you could skip to the next slide. So the 3 main types of resources that we have that I would recommend are our fact sheets, our inspiring stories, and our Aspiring Doc Diaries blog. So the fact sheets are one of our most popular resources because they provide quick but thorough information on a number of topics that pre-meds really care about. So for example, a couple of topics we have are, what it's like to shadow a doctor, how to decide whether or not to take a gap year, and if you do, how to make the most of your gap year, and also things like what it's like to see a patient for the first time. Our inspiring stories are interviews with medical school students in a very structured Q&A format, which I will share a little bit more about those later. And then one of my favorite resources, which you'll see a screenshot of on the right-hand side of the slide, is our Aspiring Doc Diaries blog. This website features blog posts from over 300 pre-meds medical students and residents. And these are longer form narrative first-person stories that give you a glimpse of what it's like to live a day in their shoes. For example, we have stories about what it's like to work as an EMT and get that very first call to assist your first patient. We have stories about what it's like to be a medical student with a disability, and also what it's like the very first time you may have to deliver bad news to a patient. So these are really poignant pieces that make you feel like you are directly in their shoes. And many of our writers are also repeat contributors, which is really awesome. So you can follow their journey from when they were a pre-med student all the way to when they become a resident. One of our writers authored over 20 stories over the course of 7 years. So I definitely recommend checking out her journey. Next slide, please. So another really critical theme that we hear from many of our students that we work with is the importance of representation. And many of the students say that they initially didn't think they could become a physician because they hadn't seen physicians who look like them. And so this is something that we keep in mind in all of the stories and the content that we produce. And through various programs and partnerships with other organizations, AAMC is trying to increase diversity, equity, inclusion, and that's a very big part of everything that we do. Next slide, please. So we also have a large collection of inspiring stories, like I previously mentioned. These are interviews with medical students who've overcome significant obstacles along their journey. So this could be, someone who maybe is a first-generation student who had trouble with access to similar resources as others. It could be stories from students who've been diagnosed with a medical condition themselves, or students who've even changed their careers later in life and then successfully matriculated to medical school. So I also definitely recommend you check out this collection. Next slide, please. And then last but not least, I also want to share with you the monthly Premed Navigator newsletter, which is free, and it comes out on the very first Sunday of the month. And this newsletter features stories, tips, financial aid information, and events for pre-meds. Our very next issue is actually coming out this Sunday. So if you go to our website, right there on the slide, you can subscribe today for free and you'll get that in your inbox on Sunday. I will give you a teaser. The very first article that's going to come out is going to be promoting our virtual medical school fair, which is on October 12th. I'll also drop that link in the chat when I have a second. But this is completely free. It's one of the most popular newsletters in all of the AAMC, and it's basically just a cliff notes of everything you would want to know as a pre-med. So thank you all. I hope that you find these resources helpful. And now I'm going to transition it over to my colleague, Tony, who's going to talk about the SHPEP program.
Thank you, Laura, and I really appreciate the warm handoff. Let's talk a little bit about the Summer Health Professions Education Program. As you can see on our slide right here, we have our contact information. So if you have any questions about our program processes, our policies, or anything about that, please feel free to give us a call toll free at 1-866-587-6337 or email us at shpep@aamc.org. I want to really say right here that our application is getting ready to open up November 1st. So this is right on time for each of you starting to prepare for a potential career in the health professions. But let's jump into it. What is SHPEP? Well, SHPEP is a free 6-week summer enrichment program for college freshmen and sophomore students who are interested in the health professions. And our program is truly committed to strengthening the career development of underrepresented, economically disadvantaged students while preparing them for a successful career in the health professions. And let's talk a little bit about the health professions tracks that students can ultimately pursue. They can gain experience in medicine, dentistry, nursing, optometry, pharmacy, physical therapy, and public health. And they can gain this experience at any one of our 12 program sites, which are Columbia University, Howard University, Rutgers, the State University of New Jersey, UAB, University of California, Los Angeles, and Charles R. Drew University, University of Florida, University of Iowa, University of Louisville, University of Nebraska Medical Center, University of Texas Health Science Center at Houston, UW, or University at Washington, and last but not least, Western University of Health Sciences. As we start thinking about the benefits of our program, well, each student receives housing, meals, a stipend, and travel assistance from their home to the program site and back. But most importantly, they gain guidance from current admissions deans, health professionals, students in health professions programs, and our alumni base of over 30,000 about how to pursue their profession of interest. To be eligible for our program, students need to be a high school graduate and currently enrolled as a freshman or sophomore in college, have a minimum overall college GPA of 2.5, be a U.S. citizen, a permanent resident, or have been granted DACA status by U.S. Citizenship and Immigration Services. And last but not least, they cannot have participated in the program previously. We want to make sure we're an equitable program, and we want to give students the opportunity to really participate in SHPEP. Now, there are other factors for consideration, and they include that a student either identifies with a group that is racially or ethnically underrepresented in the health professions, they come from an economically or educationally disadvantaged background, or they've demonstrated an interest in issues affecting underserved populations. Now, I want to pause right here and say that our program sites engage in what's called holistic review, which means they're looking at more than just your GPA. So with that being said, it's critically important for you to submit a personal statement that's compelling and a very strong letter of recommendation. So let's talk a little bit about what you'll do during SHPEP. Well, our students gain academic enrichment in the basic sciences and math, career development activities, such as mock interviewing, developing your CV, getting your resume stronger, learning and study skills workshops, which will help you maximize working in individual and group settings, exposure to clinical settings, which is what's needed to matriculate into a health professions program, workshops in financial planning and health policy, and IPE, interprofessional education that addresses effective collaboration across the health professions. Ultimately, you get to learn how each of the health professions work collaboratively with one another. And that being said, I want to also say that our program application will open November 1st. We look forward to you applying. And that being said, I'm going to toss it over to my colleague, Candace, to talk about the Fee Assistance Program. Candace, feel free to take it away.
Thanks so much, Tony. So as you all look into applying, you realize that there is a financial component in the process of applying to medical school. So the MCAT exam, the application process, there's all costs associated with that. But here at the AAMC, we firmly believe that the cost should not be a barrier to becoming a doctor. And that's why we have the Fee Assistance Program. So before registering for the MCAT and applying to medical school, this is the program you definitely want to start off with and look into, because this program assists those who, without this financial assistance that we offer, might be unable to take the MCAT exam, might not be able to afford the AMCAS application, or some of the other resources that we have to offer at the AAMC. So if you are approved for our Fee Assistance Program, you receive a reduced MCAT registration fee. So currently the MCAT registration is $330, but if you're approved for Fee Assistance, it's reduced to $135. You also get the MCAT preparation products. So you get the MCAT official prep online only bundle as part of the benefits. You also receive a complimentary access to the medical school admissions requirements database, and that's for 2 years. It also includes a waiver for all AMCAS fees for one application submission, and that includes 20 medical school designations. It's also important to note that many medical schools also waive the secondary application fee for those who are approved for fee assistance, so that's an additional benefit. It also has a waiver for our AAMC Preview Professional Readiness Exam registration fees. And if you are awarded fee assistance and you are actually applying for testing accommodations for the MCAT exam, you also have access to a stipend towards an evaluation if it's required to support your MCAT accommodations application. Now, benefits are not retroactive for the program, so in order for you to use the benefits, you must apply to the program before you register for the MCAT or you submit your AMCAS application. And also, since we have the MCAT prep products that are included as part of the benefit, we recommend that you apply to the program before you actually start studying for the MCAT exam so you're able to really take advantage of all the benefits the program has to offer. And if you are awarded the fee assistance program benefits and you utilize all of the benefits available to you, you actually save over $2,000. So it's a really, really great program if you qualify. So let's talk about the eligibility. Next slide, please. So to be eligible for the fee assistance program, you have to have a U.S.-based home address. And fee assistance program award approval is tied to the U.S. Department of Health and Human Services poverty level guidelines. So this year in 2022, you're granted fee assistance benefits if each household reported on your application has a 2021 total family income that's 400% or less than that 2021 national poverty level for that family size. And we have the income eligibility guidelines chart available on our website so you can see how that falls. Then parental financial information and supporting tax documentation is required for applicants under age 26, and parental information is viewed independently of the applicant's data, but it must fall within the same eligibility guidelines. And if you visit our website at aamc.org /FAP, you can start the application and read our essentials, which has details about completing the application. Now I'm going to transfer it over to Leslie to talk more about everything MCAT.
Hi, everybody. So I am going to just scrape the surface about the MCAT exam and give you a little information, general information. All of the content that I talk about today is on our website at the address listed. But hopefully there will be something for everybody in these next few slides, no matter where you are in your journey to medicine. So the MCAT exam is a standardized, computerized based multiple choice exam, and it's taken at a testing center. Almost all US and some Canadian schools are going to require you to submit recent MCAT scores with your application. This exam is going to test you on the knowledge and skills medical students, faculty, and residents identified as important for success in medical school and the practice of medicine. And thinking about this exam, it really is a critical thinking exam. It specifically assesses your problem solving, critical thinking skills, as well as your knowledge of those scientific concepts and principles that are important to the study of medicine. So the exam is divided into 4 multiple choice sections. There's no writing section on the test. The 4 sections include 2 that cover natural sciences. There's a behavioral and social sciences section, and there's a critical analysis and reasoning section. And so the sections are going to test content found in Intro to Bio, Physics, Psychology, and Sociology. And in addition, they also cover subjects in Intro General and Organic Chemistry and first semester Biochemistry. And so overall, the exam is going to take about 7.5 hours, but that's not all content time. This includes checking in and also taking breaks. And there's a couple administrative tasks. There's a tutorial before the exam that allows you to kind of click around and see the functionality. And there's a brief after exam survey. So we get this question probably the most, which is, when is the right time to take this test? And so I'm going to talk through a few questions you want to ask yourself, and you can ask yourself those questions today. Like I said, I think it's important to start thinking about this if you are thinking about applying to medical school. So you want to think about what year that you want to start medical school. So a lot of examinees will take the MCAT exam in the same year that they're also working on their applications. So keep that in mind, but that does not mean you have to follow that path. We have some helpful resources on our website that show when schools accept scores and how long they'll accept MCAT scores. You also want to ask yourself if you're familiar with all the content tested on the exam. You really want to take this test when you're ready. Don't take it as a benchmark. Don't take it as a practice test. You really want to make sure you feel comfortable and you are comfortable with that content. The exam doesn't require any coursework for you to have completed before registering or taking the exam. It's all based on what you feel you're comfortable knowing, and if you need to do some more self-study or potentially take a course on some of that content to feel confident. And so think about that before you register, and think about if you're going to want to have a test date earlier in the testing year or later. And the next point I want to make, and we don't like to think about this, but consider if you think you're going to want to retake it. Again, no one likes to think about it, but if that's in your mind, think about scheduling your exam earlier in the year, so that'll allow you enough time to get those scores back, take a look at the scores, and then schedule another test if you wish. And always keep in mind, there are some testing limits around the exam. So you can take the exam up to 3 times in a single testing year and 4 over 2 years. There's a lifetime limit of 7, but based on all of our information and data collected over the administration of this exam, it's more than ample time for examinees to test. And so on this next slide, we're going to talk a little bit about preparation. This is my favorite topic. And again, only going to scrape the surface on this, but we have a lot of high quality free resources on our website that are accessible and really useful, regardless of where you are in your journey, to really get started and think about this test, and encourage you to check them out. But I want to just mention 2 off the bat. The first is our study plan guide. Take a look at the study plan guide. It has a lot of great information in there of things you can start assessing and thinking about now. Second thing I want to mention is we are releasing a free full-length practice test in October. It is scored, so we're super excited to make that resource available. This will complement a second free practice test we have that is available now. But these tools are really helpful. Like I said, if you want to get a benchmark, see where you are, evaluate your progress along the way of your study cycle, or even take a rehearsal exam before you test. So I am going to pop a couple links into the chat. One of them is going to be, I think this is a great place to start for preparation. It's our YouTube playlist for MCAT prep. You can go there, see all the different kinds of presentations, see information about free resources, hear medical students talking about how they prepared, what they wish they would have done differently. And then there's a second link I'm going to pop into the chat, which is we have an examinee webinar coming up next week on October 6th, where if you are thinking of taking the exam in 2023, you can come on. We're going to do an overview of the testing year and the registration process, which registration opens October 25th and 26th, and we'll be there to answer all your questions. So I just want to thank you so much for your time, and I'm going to turn it over to Julie.
Actually, we're going to go back to Candace first to talk about the AMCAS.
All right, thank you. So next slide, please. So what is AMCAS? If you are thinking about applying to medical school, or you're going to apply to medical school, you will be completing the AMCAS application. So the AMCAS acronym stands for the American Medical College Application Service, and it is the centralized application service for most MD programs in the country. AMCAS, it's typically known as the primary medical school application because a majority of the medical schools actually require you you to fill out a secondary application that has more school-specific information. The AMCAS application contains 3 main steps. You'll complete and submit an online application. Then our AMCAS staff verifies your application and we send it to all the medical school programs that you have designated in your application. So that's what we handle for you. Next slide, please. Here is a look at the typical application timeline, which we refer to as the AMCAS application cycle. The application cycle is actually 1 year ahead of the current calendar year, and it's offset like this because the application cycle corresponds to when you hope to start medical school. So we are currently in the 2023 AMCAS application cycle, and that's because our applicants applying now this year, it is for them to start in the late summer or fall of next year in 2023. And the AMCAS application starts in May of every year. Then medical schools begin receiving your processed applications in late June of each year. And once your process application is sent, medical schools begin their review process, and then you'll receive a secondary and as you continue to be screened on interviews from medical schools. Now, medical school admissions are rolling, so submitting your materials earlier rather than later is a really great idea. And you'll need to keep track of the medical school's AMCAS application deadlines, as this is the date that your application needs to be submitted to us here at AMCAS. Then your official transcripts must be received by AMCAS within 14 calendar days of a medical school deadline, and you'll find these deadlines in the medical school section of the application and also on the AMCAS website when you're ready to apply. Next slide, please. So the information requested of you in the AMCAS application is relatively straightforward. However, it is a very detailed application, so know it will take you some time to complete the application in total. The AMCAS application has 9 sections that you can see listed here. And again, it asks for a range of information about yourself. And the sections are pretty self-explanatory, but I do want to highlight a few sections that require a bit more time and thought for you. So the first one is the coursework section. So in this section, you'll enter every college level course that you have attempted or completed. And this is actually the section that typically takes applicants the most amount of time because on average, applicants enter about 52 courses, and that's from about 2 to 3 different schools. Then another section that takes a little bit of time is the work and activities. So this is designed to give you the opportunity to highlight your work experience, your extracurricular activities, awards, honors, and publications. And you can add up to 15 entries in this section. And you're also allowed to select 3 experiences as your most meaningful, and you're given an additional writing prompt so you can reflect on those experiences in writing and let the admissions officers know why those are most meaningful to you. Then the last section I just want to highlight is the personal comments essay or the personal statement section. So this will also take some time for you to draft and finalize your statement because this is your chance to let schools know why medicine and why you want to be a doctor. So you definitely want to take your time with that section and do a couple revisions to get that finalized. So now I'm going to pass it over to Julie to talk about all things first in financial aid.
Thank you so much. And again, I'm really happy to be here with all of you. I'm not going to spend a lot of time talking today because I'll tell you the reason why. Well, I can talk about financial aid for over an hour, probably 2 or 3 if you really get me going. So what we're going to do is we are actually going to have another webinar for you coming up in conjunction with HPSA and SDN. So look for that information. But right now, I just want to give you a brief overview of what you can find on the first website, which goes over all financial information that you need when you're thinking about applying to medical school, as far as the cost to apply, as well as different resources that are going to be available to you throughout medical school and even beyond, because we actually will be with you for many points of your career. So let's go to the next slide and I'll show you a few things that you might want to take a look at. First of all, this is what you're seeing. This is our first website homepage. And from here, we have fact sheets, which are informational articles about sometimes pretty confusing or overwhelming topics about financial issues. So I encourage you to take a look at those. We also have videos and webinars. You can go back and watch a previously recorded video or a webinar. You can sign up to attend a new webinar. As a matter of fact, it's not up on the website yet, but in October, we are doing a financial literacy webinar, and it's going to be all about a credit. So that's for absolutely anyone that is interested in learning about improving, maintaining, and monitoring their credit. We also have resources on our website, and these resources could be print publications, they could be charts, infographics, anything that you might want to take a look at or read more about. We also have tools that are available to you. Our most popular tool is the MedLoans Organizer and Calculator. This is actually designed specifically for medical students and residents to house their student loan information in a secure place, but probably even more importantly, to take a look at what repayment might look like. Because we know that it's not inexpensive to go to medical school. We know that you're likely going to borrow student loans to provide for all of the costs that it takes to fund your education. So we want you to know what repayment will look like. But above all, we want you to know that no matter how much you need to borrow to attend medical school, you are going to be able to afford it. You will be able to pay back your student loans. And this calculator is going to show you what repayment realistically looks like based upon how much you might borrow, based upon how long you might be in residency, and also based upon how much your future potential earnings may look like. And then even if you're not ready to apply right now to go to medical school, this is a program, financial wellness. It's a program within the first program that helps you with your financial skills, learning how to budget, learning how to figure out what's it like to maintain a good credit score. What about setting financial goals for yourself? Do you have credit card debt? If so, how long is it going to take you to pay that debt off? And how can you work at paying the least amount in interest? Maybe you're interested in learning about taxes or insurance or buying a car. All that kind of information is for absolutely any consumer. And so financial wellness isn't just for pre-meds, med students, or residents. It's for anyone. So I encourage you to go out to the first website and then work your way over to the right and to the bottom of the page. Sign up for a free financial wellness account. It can help you at any time that you need some reliable financial information. So that's an overview of what you'll find on the first website, but this next slide is going to be really helpful for you because in just a few weeks, you have the opportunity to join not only myself, but Candace will be back with you to talk more in depth about the fee assistance program. Answer any questions that you have about financing your medical education. Get some more in-depth information about the fee assistance program. Maybe by that time, you'll have time to read over all of the resources that are on the fee assistance program website. Maybe you'll come up with some questions. That's going to be a great time to join in the next webinar to get your questions answered. We're, of course, going to be here for you for the next 20 minutes or so to talk about and answer any questions about all of the resources that we just mentioned to you. So without further ado, I'm going to turn it back over to Brandon to sum everything up, and then we'll take your questions.
Alrighty, awesome. Thank you so much, Julie, and thank you to all of our presenters today. I definitely want to provide you with a few more pieces of information, and then we can wrap up and take some more of your questions. So I know we gave you a lot of website links and a lot of information today. You may not have had time to jot all of those links down. So if you want, I'll pause here for a few seconds, give you an opportunity to take a picture of this slide for safekeeping. But I think you're also going to have access to this recording afterwards. So no worries if you don't get it, but I'll give you a second. Alrighty, so moving on. As we wrap up the presentation portion of today's session, I want to encourage you to look into some of our upcoming AAMC hosted and supported outreach activities. We definitely encourage you to also follow us on social media, so Facebook, Twitter, for information, tools, tips, and quick answers to your questions. So you can find that contact information on the right-hand side. Then as far as our upcoming events, we've already discussed the virtual medical school fair on October 12th and 13th. That's a free event. It's going to be a wonderful event, a great opportunity to interface with medical school reps and other AAMC staff just to get questions answered and to attend some wonderful sessions. And then we also invite you, if you are local or just, or if it's accessible, to join us in Nashville for our Diversifying the Next Generation of Doctors career fair and workshops in November, on Saturday, November the 12th. And again, that's an in-person event in Nashville, Tennessee. And we'll locate the link and drop that in the chat as well for you to register for that event if you're so inclined. And then some of the conferences that we'll be attending over the next few weeks include the American Indian Science and Engineering Society National Conference in Palm Springs, and we'll also be at the annual Biomedical Research Conference for Minoritized Scientists in Anaheim in early November. So if you're going to be at either of those events, find our table, come say hello. SHPEP will be represented at those conferences as well. And we always welcome the opportunity to interface with you in person. So without further ado, I think we can bring everybody back on. I'm going to stop sharing my screen. And I think we can start taking some questions. So let's see. Let me go to the comments. Feel free to start dropping any questions in the comment section, and we'll go from there. So I see we have a question from YouTube. Alrighty, hello. I'm working on my. Oh, this is so neat how this pops up here. I'm working on my fee assistance program application, but I didn't file taxes in 2021. Not working due to the pandemic. In place of a copy of my 1040, should I send in a letter of non-filing from the IRS? Candace, I'm assuming you're going to take that question for us.
Yeah, so whatever you have for your income is what we can accept. So if you have your W-2, that's fine. If you have this form from the IRS, that's fine too. But we do need the information that shows your proof of income. So in the case of you not filing taxes, I would say your W-2 is the next appropriate supporting documentation to submit to us.
Thank you so much for that, Candace. Alrighty, next up, let's see. We have another question from YouTube. Alrighty, so working as an EMT, is it beneficial for medical school applications, even if it's only in a transport company? So I think Candace said that's given AMCAS, so I'll toss it over to you as well.
Yeah, this is a really great question. And I would say any sort of experience that shows your commitment to wanting to be a doctor and working with patients is great in your application. You also will want to check with medical schools because different medical schools have different requirements and look at different experiences differently. So I definitely encourage you to look into any of the medical schools you're interested in, check out their websites and see what they interpret for experiences, whether it's like something clinical versus non-clinical. And you can also get the information in the medical school admissions requirements database too.
Nice. Thank you so very much, Candace. Alrighty, and we have our next question is going to be directed toward okay, and I guess let me check in really quickly before I move to our next question. Laura, did you have anything to add to the previous question as well, based on your work with aspiring docs, some of our other resources as well?
I would echo what Candace said. I think that absolutely that would be beneficial for your application. We have lots of stories from folks who have previously been EMTs and they have mentioned to us that they've been asked about that experience in their interview. I would also encourage you to pursue things that you are passionate about regardless. And so if that is an experience that speaks to you, absolutely, because also you want to keep in mind when you talk about your experiences, it's not just the line item bullet saying that you've done it. You want to talk about what you've learned from it and how and what it's meant and the significance of it. And so if that's something that calls to you, I highly recommend you pursue that experience. I hope that helps.
Absolutely. Thank you, Laura. And I think you also illuminate a great point that we often like to make to pre-med students who often feel like they have to take on the world in order to have a great application. Just remember, it's not about the quantity of things you do, it's about the quality of experiences that you engage in. So just remember that. Thank you. So we'll move on to the next question. And this is going to be dedicated to Tony, or directed to Tony, rather. How do applications for the various SHPEP locations work?
Sure. So, you use our centralized application. You could find that at shpep.org, and you can apply to up to 3 program sites and whichever tracks floats your boat. So if you want to, apply to Howard University and their medicine track, you're able to do that. If you want to apply to Columbia and check out their dentistry track, you can do that too. What I always tell students to do is when they're selecting sites, select, one that's within your time zone, one that's going to give you a culture shock, and then your top choice. I think that's a great way to kind of attack the application when selecting sites.
Thank you so much for that, Tony. Alrighty, so next up, well, let me read. We did get some shout out to the Fee Assistance Program team. Just wanted to make sure you heard that, Candace, that you all are extremely helpful. So glad to hear that, as always. Next up, we have another question that is asking, is SHPEP good for someone interested in pediatrics?
I would say yes. You're able to, when you gain that clinical exposure, they link you up with somebody who's within your interested field, and each program site could speak to like some of the pathways and some of the specialties within those pathways and things like that. But if you're interested in pediatrics, if you're interested just in medicine in general, SHPEP definitely looks great on an application. Over 65% of our scholars that do apply to medical and dental school are accepted. And it's a very widely known program. And again, it's really with a focus for those who are underrepresented and disadvantaged within the health professions. So if you're not sure ultimately on what you want to do, you are confused and you're like, hey, you know what? I may be interested. I have a good, strong science focus, but I'm really not sure. You can explore the health professions with us, and maybe, just maybe, you might find another pathway that's a little bit more suitable for you too.
Thank you so much for that response, Tony. Alrighty, so next up, are there certain aspects of the medical school application that are more important than others? For example, would working as a CNA be more valuable than publications? So I'm thinking, I know that it's phrased, are certain aspects of the application more important, but it sounds like maybe they're referring to experiences. So I guess they're kind of asking if some experiences are weighted a bit more heavily than others. So I would love to hear any perspectives that you may have on that, Candace, and any other members of the panel that may want to weigh in after.
Yes, absolutely. I think I want to echo what you mentioned earlier. Brandon and Laura mentioned this about the quality over quantity. And it's really important to, like Laura said, do things that you're interested in, do things that represents and shows your commitment to working with patients, being a good physician, being in healthcare, and that's what's most important. So a lot of medical schools practice holistic review, which means they look at the full picture of an applicant. So not just your GPA, not just your MCAT score, they're looking at your experiences, your background, and you really just want to make sure you do work to have yourself as sort of a well-rounded applicant where you are demonstrating your commitment to being a physician.
Absolutely. I love that response, Candace, and thank you so much. Were there any other perspectives, or did anyone else want to speak to that particular question?
I agree with what Candace would say. I also wanted to add that AAMC actually has a resource on our website called Anatomy of an Applicant. And I think part of what this question is asking is to better understand the different components of the application and how medical schools may view them all together. And so we have this resource. I will add the link to this in the chat, but we have about 20 profiles of students who've been accepted to medical school, and we interview the student, we interview the admissions representative from the medical school who actually reviewed their application, and we also interview their pre-health advisor, and they discuss their experiences, they discuss their academics. Some of them go into some of their credentials and they talk about their experience with the MCAT. And this will give you sort of an inside look into how schools perform holistic review and how all the components of an application come together in that process. So I think that might also be really helpful to check out.
100% agree, Laura. And I think something that I take away from what both you and Candace both describe and discuss in your response is the fact that it's important to not think of, although there are various components to the medical school application, it's important to not think of them as like disparate pieces. Like you're painting a picture of yourself as a candidate or an applicant to the medical school, and medicine is a profession that you're bringing your whole self to. So the application, the review committee want to understand who you are across the board. So think of everything as being an important factor, and not necessarily this is the highest weighted thing, so I'm going to put the most attention on this. Think about how everything that's required and asked of you in that application process contributes to you achieving that ultimate goal of becoming a doctor and getting admitted to medical school first. All right, so moving on to our next question. So this individual is asking, since SHPEP is in the summer, and someone may not meet the GPA requirement at the moment or at the time of application, but they're able to get it by summer, are they still able to apply right now? And Tony, I'm going to pass it over to you.
Sure. So it's really you need to have the GPA at the time of application, right? So if you have it for the summer, I mean, that's great, but unfortunately you wouldn't quite be eligible for the program. But what I will say is that, the semester, for most students, the semester typically ends, around like December, and maybe there's like the next session or the next semester that to go along with that. So if you have it by December or January, right, then I would encourage you to apply. We've had a lot of applicants actually within the last 2 weeks of January fill out an application and get accepted and actually live out their dreams. So definitely I would, if I'm the student right now, I would tell the student to grind, make it happen, and then from there, see where they stand at January.
I think that's wonderful advice, Tony. And just want to echo that you can get there. We believe in you. You have some extra support. But remember, that application opens on November 1. It doesn't close until the beginning of February. So you have some time. And we, hope that we see your application. All righty, next up. As a student that is working towards achieving their bachelor's degree, when should you think about taking the MCAT? And this was, of course, one of the questions that we, as Leslie stated during the presentation, we get all the time. Leslie, kind of looking at the way that this question is posed here, are there any additional tidbits or, feedback or advice that you would provide?
Yeah, I was so excited when I saw this question come in because Brandon's right, we do get it a lot. I think it's great that if you're earlier in your undergraduate career or anywhere before graduating and getting to that junior or senior year, to really know that if you know you want to take the exam, there's a couple things you can do. So one tip that we've heard pre-health advisors give their students a lot is when they come in as a pre-med first year is to download our content outline. It is on our website at the address that we showed during the presentation. And you can download it actually as a PDF. I know those are going out of style, but you can still download it, print it out. And one great thing to do is to kind of highlight where you're learning those concepts and skills through your undergraduate coursework. That way you kind of have a running inventory of not only the concepts you're learning, but you can also flag the ones that maybe you need to go back and refresh as you get closer to taking the exam. So strongly encourage encourage looking at that content outline. And it's not asking you to study, like start studying right away 3 years in advance, but it's really great materials to have because you'll want to go back to those when you do start formally preparing. The advisors always call this building your binder. So it's just a good way to keep organized. The second thing I want to mention when we talk about when should you start preparing, again, these are long-term strategies, but please check out our study guide to creating a study plan. We have in that plan some fantastic best practices and learning strategies that we encourage students. These will help you in undergrad, just your normal coursework, but they will also help you when you get as you are preparing for this test. So it really helps students hone those strategies that work for them. It focuses on practice and active learning and cultivating those skills. And those skills are things that you're going to use to apply not only when you're studying for tests and tests like the MCAT exam, but also when you're in medical school. So those are long-term strategies. Now, I didn't just ask when you should, how you should back up your preparation. But again, keeping those 4 things I mentioned on the slide, thinking about when you want to enter medical school and kind of working backwards from there, and when you want to submit your application. And anecdotally, a lot of our data that we collect shows students spend about 3 to 6 months preparing, but I got to tell you, it's a long tail. Students take gap years, students take breaks, and that is all great. Again, you want to be mindful, take your time, and take the exam when you know you're ready.
Superb advice, Leslie. Thank you so much for that response. So I just want to do one quick kind of shout out to the crowd. We're nearing our last few minutes of the session, so please feel free to get I think we'll take maybe one more question. I see we have one here in the chat, and maybe if there's one or one more burning question that someone in the audience has, go ahead and get that in before we wrap up. So next up, we have a question, and I'm going to direct this towards you, Candace. How long does it typically take for AAMC staff to verify a student's AMCAS application?
Yeah, great question. So during our peak time, which is at the end of May when submission opens through those summer months, it can take about 6 to 8 weeks for your AMCAS application to get verified once it's submitted. And that's actually because the verification process is actually staff doing a line-by-line comparison. So like I mentioned earlier, each applicant enters about 50 plus courses into their application, and it's doing a line-by-line comparison of those courses you entered in your grades with your transcripts that you submit to us. So it's a lengthy process. So during our peak time, it does take about 6 to 8 weeks to get your application verified.
Awesome. Thank you so much for that response. Alrighty, so as we wrap up, I would love to just go around to each of our amazing panelists and presenters today, and just to get, one last piece of advice or, an extra resource shout out, maybe something we didn't get to in today's session, or just, something that you would like to leave our audience with. And I'm going to start with you, Laura.
The thing that comes to my mind is if you have a question about medical school application process, what it's like to be a medical student, even something, what it's like to be an EMT or what it's like to volunteer at a hospital, like, please don't hesitate to reach out. And, of course, you have your network, but even just online through social media, through Instagram, through different forums, the pre-med community and the medical student community they're so passionate about this field. And often, I just see threads on Twitter from medical students answering questions and things like that. So please don't give up if this is your passion. And if you have questions about anything, please reach out, because you'll be surprised at how much people want to help and how proud they are to be able to step back and help the next person, help the next generation become a doctor. So just consider that and don't be shy, and good luck.
Thank you so much for that, Laura. Yes, it's important to remember this is not a solo endeavor. There's support on all sides, and just lean into it, and we'll help you find it if you don't know where to look. Julie, I'm going to toss it over to you next.
Thank you. And again, thanks for joining everybody. I want to say that from a financial perspective, because that is my wheelhouse, I want to say that I don't want anyone to shy away from following their dreams because of the cost of a medical education. So if you are concerned about that, please join us next month for the webinar about financing and medical education. Come to the FIRST website. If you're not finding what you need, email me. You can email us at first@amc.org. And we are happy to help you in any way possible. So follow your dreams and take advantage of all of the resources that are available to you. And thanks again for joining.
Thank you so much, Julie. Such important words. Tony, I'm coming over to you next.
Thanks, Brandon. And as I think about just the AMC and core competencies, right, the one that really sticks out to me is resiliency. And sometimes you're gonna have people that tell you, no, you can't do this, or no, you're not good enough. You may even go through something what's called imposter syndrome, where you don't feel like you're good enough to actually make it. With that being said, one, have that belief in yourself. Two, really you really hone in on your support system and make sure that you're having some of these communications with your family members, with your friends, and with your pre-health advisor, right? Just to make sure that you're really, fully well resourced and up to date on everything that's going on. And, again, keep pushing forward. And, when people tell you no, you tell them yes. And that's my final piece of advice.
Oh, I love it, Tony. Thank you so much. Alrighty, and next I'm going to come over to you, Candace.
Thanks, Brandon. So, as we had some questions around experiences, I will just echo get that quantity over that quality, excuse me, over quantity. Really think about getting into experiences that show why you want to be a doctor and your passion for working with patients. And also reach out to the medical schools. Like they have staff that want to answer your questions, they want students that align with their mission. So reach out to them, get to know what they're looking for in an applicant. They're happy to give that information and share it with you.
Yes, snaps to that. Thank you, Candace. And Leslie, I'm going to turn it over to you now.
Yeah, thanks, Brandon. So I just want to share a couple more resources to support your journey and to help and take in thinking about and preparing for the exam. First, I'm going to echo what everyone said. Please don't hesitate to reach out to us. Your MCAT outreach team is on the other end of that Twitter handle. We answer emails. We are here to support you and answer questions. We know this exam is a lot to study for, and you can do it. It's a process, but you can do it, and we have resources to help you. And I also want to mention that the NAAHP, NAAHP, NAAHP.org, if you don't have a pre-health advisor, they have some information on their website. They have volunteer members who will contribute time to helping you if you don't have a pre-health advisor. So really encourage you to look at that resource. It's under the student resources menu item. And then finally, we've got some great testimonials on our website of students who've taken the MCAT exam and what kinds of strategies and they've used and tips they've used to take the exam, and they are now medical students.
Awesome, awesome, awesome. Well, thank you to each of you for being here and sharing your wisdom and expertise with our audience today. And thank you to our wonderful audience. I can't see you, but I know you're all out there with your smiling faces, and we've enjoyed speaking with you this afternoon. Remember, the AAMC is not just a resource for when you're trying to get into medical school, but once you get there and on into your career as a practitioner. We believe in each and every one of you, and we're here to support your journey, no matter what it may look like and no matter where you may be at the moment in your journey. So thank you for the time today, and we wish you all the very best.